Hi, we're Team 4 representing the University of Sydney.
The Pacific Rim has been a geographical location of importance in recent times with global discussion and debates around the Pacific Rim trade deal. Equally of importance is the health of the people of a region with burgeoning nations and particularly the issue of smoking. According to WHO data and in males where the issue of smoking predominates, developing Asian countries have their prevalence rates above 40%, such as the Philippines at 43%, Malaysia at 43%, Thailand at 41.4%, and most notably Indonesia at 76.2%. China, which is ahead of the curve in terms of development, still, however, records a prevalence rate of 47.6%. Whereas more developed Asian nations have lower prevalence rates, with Japan at 33.7% and Singapore at 28%. In countries such as Australia, who are one of the leaders in anti-smoking policy, with measures such as plain packaging, the prevalence is 16.7%, which is the lowest of the Pacific Rim nations. Canada is at 17.7% and USA at 19.5%. The face of the smoking issue in the Pacific Rim is epitomized by a young chain-smoking Indonesian toddler. In a country where companies such as Philip Morris have infiltrated, the Philippines has shone as a bright light for macroeconomic policy, with their Pagovian syntax both deterring smoking as well as shifting much-needed resources towards prevention and care for smoking. The Pacific Rim trade deal in itself has brought challenges in halting the scourge of smoking with the use of free trade as a weapon in disseminating cigarettes to developing countries where smoking remains high despite being signatories to the WHO Convention on Tobacco Control. As signatories, overall there have been efforts such as banning smoking in public places. However, implementation and adherence has been an issue. And in no place is this more dire than in present-day China.
Our justification for choosing China is based on the following factors. China has a significant historic and cultural aspect of smoking. Right? Smoking has been a major cultural feature of the Chinese society for the last 400 years. As an example of how deep it runs in the Chinese society is how a refusal to accept any tobacco products when offered is an insult and is frowned upon and considered a reluctance to socialize.
在中国，一般会在饭局上，年轻人会给长辈递香烟。有时候，如果你不给一个吸烟的长辈递的话，有些时候算是一种失敬的行为。在中国，一般来说在喜酒或者各大习俗上面，也会有人分香烟这样的行为，来表示喜庆。
那个工具包里面都有烟，但是我一个人从来不抽。后来当那个小官以后嘛，就联系工作多些了嘛，那就抽起来了。抽起来后来20年了，每天早上起来都要嗑干嗑，嗑了有时候有痰，后来不抽了也就慢慢就好了。抽了20年，戒了10年。
As a nation, it is the single largest consumer of tobacco, with approximately 315 million active smokers, according to the latest WHO statistics. 44% of the world's cigarettes alone are consumed in the nation. Tobacco consumption is on track to claim about 200 million lives in China by the end of the century, resulting in dire consequences on their healthcare system and economy as a whole. There have been many proposed tobacco control measures in China, mainly increased levy of taxes, along with banning of advertisements in varying forms in the media, along with no smoking zones in schools and public places.
电视上面有播，一直都有在科普这方面的东西。
However, the lack of enforcement of these issues has been a major obstacle in curbing the consumption of cigarettes. Another major issue is that there is a significant overlap between those who run tobacco corporations and those who run the Ministry of Health. Often, they are the same people, so there is a significant conflict of interest right now. Another issue is the ineffectiveness. This is especially evident amongst the youth, where the teenage angst and the perception of cigarette smoking as being anti-establishment and cool are strong motivators for youths to pick up the habit.
包括在同龄人之间，一般来说也会递香烟。甚至如果说你不接的话，别人可能以为你不够意思，或者不够朋友，或者你一点都不酷。
The aforementioned reasons and a significant lack of awareness amongst them about the negative health effects of smoking create the perfect storm, and something tobacco companies love to take advantage of. Now, why we chose Peking? We wanted to focus on Peking University because it is a symbol of modern China's desire to be the center for scholastic distinction. Though the smoking policy on campus is consistent with the nationwide rules regarding smoking, however, a significant proportion of the student body still continues to do so.
Our team has developed a 3-year plan on a $500,000 budget to be implemented at Peking University. This plan has 3 primary goals. The first is to increase awareness about the ill effects of tobacco amongst university students. The second is to shift cultural perception on the acceptability of tobacco. And the third is to increase support services to staff and students. We use the SWOT analysis technique to assess the feasibility of our program. The strengths of our programs are that all aspects of it is accessible and equitable to all staff and students. It uses evidence-based methodology and involves a collaboration between the scientific community and health professionals. It is a cost-effective program which involves integration of tobacco support and education programs. In every plan there will be weaknesses. In our plan, we are limited by budgetary constraints. Also, specialized experts will be required in implementing the education modules and improving support services. It also requires ongoing commitment and collaboration with a large number of people. However, we plan to mitigate these weaknesses. If our plan is successful, it will create many opportunities. One opportunity is that the success of the program may lead to spread to other universities. Awareness campaigns that spread on social media may lead to a wider cultural change within the university and the community. It may increase political interest in the cause and increase desirability in a healthy lifestyle. Health professional and scientific communities have an opportunity to take a leading role in tobacco awareness campaigns. Possible threats to our program include cultural norms which go against our policy, lack of support from government and communities, and lack of continued funding which threatens sustainability of the program.
Our program will be multifaceted, targeting each of our goals. Our first plan will be to implement a mandatory health module for students.
It will be an interactive one that will inform them about why smoking is harmful and what the overall cost is to both their finances and, more importantly, their health in general. Along with offering alternative habits that they can take up to promote healthy living, it'll have to take a bottom-up and top-down approach.
University admin staff and the School of Health will need to be involved. Before the implementation of the proposed idea, the staff will need to be trained as well. This is to guide the students to the appropriate places, not only to get more information, but also to direct them to the right places that will help them in kicking the habit. Also, there has to be a university-wide Health Awareness Week which focuses on smoking. As an adjunct to it, every major sporting event should have the stalls set up close by to reinforce the idea of smoking being seen as something bad and not good or acceptable.
We are going to use social media in order to change public perception. To do this, we will engage with student bodies on WeChat and try to inform them about the negative health effect of smoking. We aim to subsidize nicotine patches to help promote cessation of smoking among students. Psychological support to ensure maximum effectiveness will be utilized as well.
The program instituted is going to be evidence-based and tested to see if it satisfies all of the following criteria. Firstly, the effectiveness score, detailing whether prior implementation of the program was successful in other universities. The acceptability score, whether the program is appropriate for the target population. The feasibility score, which is how possible it is to be implemented with financial and other factors included, such as cultural values. And finally, the equity score, ranking the program according to their ability to target as many people equally, regardless of backgrounds and resources.
To monitor the success of the program, we will use performance metrics. To track smoking prevalence, we will use an opt-in electronic survey as an adjunct to the education module that will be completed every year. The survey will have a qualitative component, investigating the perception of tobacco among students, awareness of the ill effects, and use of support services.
The creation/licensing cost for an e-learning module will consist of an initial startup capital of $18,000 in the financial year 2018, with $2,000 per year dedicated to software upgrades, maintenance, and content refreshment from financial years 2019 to 2020 for a total of $22,000. Training of staff through a workshop would be an additional $5,000. The establishment of a dedicated psychological support services unit will ideally have minimal costs in terms of upskilling and a tapered funding structure as staff get more well-trained. So this would be $50,000 in the financial year 2018, $30,000 in the financial year 2019, and $10,000 in the financial year 2020. However, we will also account for possible additional labour costs for hires, which would be an additional outlay of $100,000. Nicotine patch subsidisation will be integrated with these psychological support services through a potential business partnership with nicotine patch suppliers, where we will get subsidised batches, especially for the initial stage of use for nicotine therapy for our university students, where the company will get a flow of students or partnered marketing. This will total $50,000 to $150,000. On top of this, our integrated social media campaign, along with Health Week and stalls, will also have cost-effective measures through possible use of student ambassadors. This will total $15,000 per year for $45,000 over 3 financial years. So overall, this would leave us with funds for risk mitigation as well as for a smoking cessation investment fund of approximately $100,000 for use in Phase 2 from financial year 2021, depending on our outlays, to ensure the overall sustainability of our plan.